Treatment options have long been limited for patients with metastatic disease, but significant progress has been made recently, with additional options emerging as researchers continue to investigate potential treatments. That's our focus today. Since May is Melanoma Awareness Month, surgical oncologist Jonathan Zager works at the Moffitt Cancer Center in Tampa. Good morning, doctor.
Good morning.
What is melanoma, and would you also define metastatic melanoma for us?
Melanoma is a type of skin cancer. It is the third most common skin cancer behind basal cell carcinoma and squamous cell carcinoma. There's about 75,000 new cases of melanoma diagnosed in the United States per year, and about 10,000 patients are going to die of metastatic disease. Metastatic melanoma is when the tumor spreads beyond that primary tumor on your skin, and the melanoma can spread to lymph nodes or any other organ. It can go to the brain, lungs, liver, bone. It can go anywhere in the body.
What is the difference then in treatment for patients with early melanoma compared to advanced?
Early melanoma, when it's localized to your skin, the treatment is to surgically resect it, to cut it out with a rim of normal appearing tissue. And then depending on the depth of that melanoma, how deep it penetrated into your skin, which we know on the biopsy, we can then go ahead and take out a few lymph nodes that drain that area of skin to see if the melanoma has spread early to the lymph nodes. So the treatment for early stage melanoma is surgical. In the later stages, when it's metastatic or after it has spread, there are multiple other options called systemic therapies, and these therapies are either targeted therapy, immunotherapies, or an oncolytic herpes virus called Imlygic. This oncolytic viral therapy was FDA approved late last year, and the herpes virus has been engineered to inject directly into the metastatic melanoma that is in a subcutaneous, cutaneous, or nodal region. We inject the herpes virus directly into the tumor, and the tumor will then rupture and die. Although Imlygic has not been shown to improve overall survival, and we don't use it in immunocompromised patients or with patients with widespread disease, I've been using it in my practice, and we've seen a very good response. About a third of patients are responding to the Imlygic treatment in my practice.
Add some additional context about how these more novel therapies are changing the melanoma treatment landscape.
About 10 years ago, 7 to 10 years ago, all we had was chemotherapy for melanoma, and the chemotherapy was very ineffective and the prognosis is poor. Nowadays, we have these powerful new systemic therapies like targeted therapy, immunotherapy. We have this oncolytic herpes virus that now we can inject into unresectable metastatic melanoma. We have much more options, and they're better options. The prognosis for these patients is better. They're surviving longer, and the treatment options are just much better than we had a decade ago.
And on a final note, what can we do to prevent melanoma?
So to prevent melanoma, you want to obviously wear sunscreen. That will help prevent all skin cancer. Reapplying the sunscreen frequently, SPF 30 or greater, wearing sun protective clothing, reapplying the sunscreen after swimming or sweating a lot. Make sure that you're lathered with sunscreen. In addition, if there's any lesions that are changing on your skin, if you have a bleeding, itching, scaling lesion or a mole that has changed color or size, you want to bring that to the attention of your primary care physician or dermatologist. The earlier they can diagnose melanoma, the easier the treatment and the better the prognosis.
Is there one website where you'd send our viewers to follow up?
Well, there's a couple of websites like melanoma.org that would have prevention type information on it, but the best website for treatment would probably be the nccn.org, the National Comprehensive Cancer Network.org website.
Dr. Zager, we appreciate your time. Thank you.
All right, thank you very much for having me.